procedure these days costs a huge amount of money. You can spend that much in a hospital very quickly having any kind of procedure.
Absolutely.
So we actually do urge our members to make more funds available than the minimum. These are really minimum levels. But of course, with inflation over time, if you sign up with the current minimums in 30 years' time, that may not be adequate. And we may have more advanced methods that may cost more money to deploy. For instance, in May at the Suspended Animation Conference, there'll be some talk about liquid ventilation, which may be a more expensive method, but give you even higher quality preservation. So we really recommend that people fund it higher than the minimum so they can afford it if it goes up, or if there are better options available. And I should point out that for those who aren't familiar with the funding, some of that money goes into actually doing the procedure, the surgery, transport, stabilization. But a large chunk of that money then goes into the Patient Care Trust Fund, which is very separate from the rest of the organization's operations income. And that money is invested very conservatively, and the interest from that is used, if necessary, forever, for as long as necessary, to pay for the upkeep of the patients, to replace liquid nitrogen, eventually to replace the dewars in which they're stored. So we don't touch most of that money. That's reserved for the future.
So the other question is the process that one who is interested in embracing cryonics have to follow. So I would provide the link to your website, but say a person comes to your website, what's the process? What's the next step in that process then?
Well, I mean, the first step, depending on the person, but the first step would be to really read about the subject, to really understand what's going on, to understand what we're doing and what we're not promising. We're not guaranteeing this is going to work. This is an experimental procedure. We don't know if it will ever work. We do have evidence that when a cryopreservation is done well, the microstructure of the brain is pretty well preserved. You can look on the website at the electron micrograph studies. So it looks promising, but we don't know.